Hello there. So for those of you that don't know me, my name is Chloe. I am a yoga teacher primarily, but I'm also a personal trainer, and I specialise in pre and postnatal movement. I say that loosely because yoga sometimes actually isn't the best thing for people that are pregnant or early postnatal, depending on their holding patterns and their strengths and the different muscles in their body that are weak. And based on that fact, one of the things that I wanted to talk to you about today was pelvic girdle pain, or sciatica in pregnancy. So this comes up a lot in a group full of sort of 12 people that have are coming to do pregnancy yoga with me. What I'll quite often find is that at least 4 of them have got some kind of pains. For some people it's like really overwhelming, and for other people it's just a little bit of a niggle that they're aware of. It's something that's really close to my heart. I had pelvic girdle pain probably more so postnatally with my first pregnancy, and then at about 16 weeks I started to get it in my second pregnancy, and by that point I was a yoga teacher, which was a little bit of an issue because every time I kind of opened my legs out to do any kind of position in yoga, it was causing me a problem. First time round, when I went to get this treated, I went to a physio, and they said that I needed to do bridges and work on my Kegals or my Kegals, depending on where you're from, which is basically a pelvic floor contraction where you consciously think about tightening your pelvic floor and then releasing it. For many women, they find it quite hard to do because there's no way really of assessing whether you're doing it right or whether you're doing it wrong unless you have a physio that assesses you internally with their fingers, which for some people feels really uncomfortable. However, I went away because I was determined to kind of fix this problem. I went away, I did my bridges. For those of you that don't know what a bridge is, it's where you lie on your back with your feet flat on the floor and you just focus on lifting your tailbone and the lower pelvis off the floor and then rolling back down through the spine to lower it. So I did those 2 things. I did lots of bridges and I did lots of Kegels, and it actually made my symptoms worse. Then I went to see a wonderful woman who lives in the northeast called Kegals, and she opened my eyes to a whole new world of treating pelvic health. And one of the things is that actually sometimes Kegels can make your symptoms worse. So for me, I have a really, really tight posterior pelvic floor. I did have before I had children, and that comes from my slightly, I'm prone to anxiety. I was prone to anxiety, was prone to being quite stressed, overthinking, wanting to overachieve and be perfect at everything. That was generally my vibe before I had children. And that also lends itself beautifully to having a very tight back body, along with my job, which was primarily sitting down sort of most of the time, and that led to quite a tight posterior pelvic floor. So actually contracting my pelvic floor was actually just making that even worse. So one of the things I wanted to share with you today was the first thing. So the first step that I made when I was looking at trying to kind of make this holistic approach to healing my pelvic floor. And very oddly, it was the first thing that I did was not to sit like this. So I went to see Colette. She gave me loads of wonderful exercises, which I will share with you as well. Not in this video, in separate ones. But one of the main things that we identified was this really tight posterior pelvic floor. Now, you can imagine when you're sitting like this, all of the weight, all of the pressure is going right through the back of your pelvic floor. You're opening your legs out, so you're lengthening your inner thighs, and then all of the outer thigh and the glutes are getting really squished together. So of course, sitting with your legs like this, trying to get out of the car, trying to get dressed where you're kind of standing on one leg and opening the other out to put all the things on, all the things where people tell me they're experiencing pain, all of these things put more pressure through the back of your pelvic floor, through the back of your body. So one of the things, very, very simply, that I started to do was to, rather than sit with my legs crossed, which was kind of where I would normally be, or quite often I'd sit, usually it's my right leg that likes to go out and my left leg that opens out like this. And you can see here, I'm already predisposed to being very open in my pelvis because when I sit, my feet want to flop out. So I already am very open, I've already got this very tight pelvic floor. So one of the things that I started to do was very simply fold up a cushion and put it in between my legs and sit like this, making sure that my feet were pointing up towards the sky. Sorry, I've probably got very dirty socks. My feet were pointing up towards the sky and my toes weren't turned out to the side. And I would do this sitting on my bottom, yes, but I would also do it kneeling, so bringing my legs together. And that was one of the really simple ways that I started to heal my pelvic floor dysfunction. And I also really focused on my breath. So when we have a really tight back chain, so from the back of the neck all the way down past the back of the rib cage, lower spine, into the glutes and the hamstrings and the calves and the backs of your ankles, we can work on exercises to create space, but we can also use breath. And this is the number one tool that I use with my clients. And although for many people breath is boring, when you layer it with movements that then means you can feel a difference when you breathe, it really does make a big difference. And what I've noticed is that then clients are way more inclined to practice the breath because they can feel that something is changing within their body. So my favourite breath to practice, and it would only really apply, you could only really do this in the early part of your pregnancy, so probably up until about 16 to 20 weeks, when it starts to be uncomfortable to lie on your back. But one of the things that I loved to do postnatally especially, and in those very early days, that 16 to probably 20 weeks, I did do this breath because it helped, is you lie on your back, but you actually put your feet flat on the wall. So you lie on your back and you've got a 90-degree bend in your leg. Your toes are pointing up towards the sky. And what you do is you push from the big toes to the little toes, the inside of the heels to the outside of the heels, and you really push the feet into the wall. And then you try to pull your heel towards the skirting board, but without the foot actually moving. So you're creating this tension through the leg. The whole foot presses in and then it tries to drag down, and immediately as I do that, I can feel my hamstrings switch on, and I can feel my glutes that are soft, they kind of switch off because my hamstrings have switched on. Then all you do is put your hands on your rib cage or on your belly. You take a nice big breath in through the nose. You open your mouth and you exhale for as long as you can. Thinking about the diaphragm, pulling everything below it up. Then you take another big breath in, filling through the whole of the rib cage. So because your back is pressing into the floor here, you can really breathe into the back space because you've got that reference point. And then a big long breath out again. Keep going until there's no breath left. Inhale into the floor, into the back. All the time pushing into the wall and trying to pull those heels down. You could, if you were progressing that, put a yoga block or a cushion between the legs just to wake up these inner thighs, these bits of you that get really overstretched, especially for those of you that like to sit cross-legged, really overstretched inner thighs, really tight outer thighs. This is going to start to make a really, really huge difference. One of the main reasons that I'm sharing this piece of information with you today is because I've been working with a postnatal client now for probably about 8 to 12 weeks. And the one thing that she said has massively reduced the pain in her back and the pain in her hamstrings and her calves is practicing these breaths every single day. It makes a difference, but it does take work and it does take practice. If you are pregnant and you are wanting to have a vaginal birth, a physiological vaginal birth without intervention, learning how to expand through the back of your body allows so much more mobility and movement in your pelvis. If you stay tuned, you'll find out other things, other movements that I can share with you that will help with this too. But the foundation really starts with the breath. If you found this useful, then do subscribe. All of the stuff that I'm sharing at the moment here on Substack is completely free. And if you want a little bit more information, I have a mother body reset, which is all about healing after birth. It's a mini course that you can buy. I also have a birth biomechanics workshop, so for those of you that are preparing for birth, you could access that and just understand some of the positions as well as the breath to help you have the birth that you perhaps hope for. Thank you very much for watching this. If you have found the breath is useful, or even if you found a huge relief just by not sitting with your legs open and sitting with your legs closed, then please do let me know. You guys are my inspiration. So the more that I hear about from you, the more I will share here and hopefully help you with your healing journey.